VA will provide and pay for and reimburse emergent suicide care for eligible veterans, whether that care is received here at a VA or in the community. And so if veterans have this emergent care episode and they are evaluated either here at the VA or in the community, and they're eligible for treatment, so they have to meet some basic eligibility, that should trigger what we're calling a Compact Act episode. And so they still have to meet some basic eligibility. I think, as we probably all know, eligibility can be a little bit nuanced and confusing. And so if you have specific questions about that, we'll direct you to our Veterans Service Center. But this is a really big deal. What it's saying is that the VA will make sure that veterans have essentially covered care, whether it's here in the VA or at the community, anytime they have an emergent suicide episode. And so that care would include that initial evaluation, often happening in an emergency room. It would include transportation to the ER. And as a clinician, I've heard many times, I really need to get to the ER, but please don't call an ambulance. I'm very worried about a transportation bill, which was, very legitimate fear. This would pay for any transportation bill to the VA as long as they have that emergent suicide episode. And then it pays for up to 30 days of inpatient care. And that can be extended under some circumstances, and up to 90 days of outpatient care as long as it relates to that initial suicide episode. And so this is good news for veterans that when they're having this moment of crisis, and obviously very understandably at this moment probably have a lot on their plate, that they're not going to have to worry about a bill on top of that. So, what is changing? So, what is not changing is clinical intervention to veterans. So, we've always provided suicide prevention care and mental health emergent care. So, here in Buffalo, we have a 24-hour emergency room. We have an inpatient psychiatric unit that's up to 15 beds that will provide that crisis stabilization that's necessary for veterans. We kind of have a full spectrum of mental health care available through the VA, and also outpatient therapy in all of our CBOCs as well. So none of that is changing. We have a suicide prevention team that can work with veterans who've had like recent emergent suicide crisis, even recent suicide attempts. We provide, sometimes really close case management follow-up, and just sort of trying to help make the VA sort of a customer service friendly place to navigate through our suicide prevention team. What this changes is it creates a new benefit for the provision, payment for, and reimbursement for emergent care, and eligible individuals can receive emergent suicide care at no cost, again, either here or outside the VA. I've attended many compact trainings, and they use a lot of different terms. So we figured we would define some of them here for you today. So they have the term emergent suicide care, which refers to crisis stabilization care provided to an eligible individual following either a recommendation from the Veterans Crisis Line, or when the individual is presented to VA or a non-VA facility in an acute suicide crisis. So I think one of the nice things about the legislation is it doesn't overly define what is an emergent suicide episode. It leaves that up to the evaluating provider to determine, is this veteran in this moment appear to be in this emergent suicide crisis? And an acute suicidal crisis is similar. So the individual who's determined to be at imminent risk of self-harm by a trained crisis responder or healthcare provider. And so then it refers to something called crisis stabilization care. So this is care that ensures, to the extent practical, immediate safety and reduces the severity of stress, the need for urgent care, or the likelihood that the severity of stress or need for urgent care will increase during the transfer of that individual from a facility at which the individual has received care for that acute suicidal crisis. And then it refers to something called crisis residential care, which I don't believe that we have in New York State. But again, since this is federal legislation, there are some states that offer something other than, ER care and follow-up inpatient stay for emergent crisis. And so I'm not exactly sure who's on the call. I see some familiar faces and names, but I think if you are working for a hospital, even an outpatient mental health agency, one of the things we really want you asking on intake forms and when you're meeting new patients is if that individual served in the military. And so really trying to get a sense for what their service was like and whether they might have some VA eligibility. And we know that sometimes people like to ask the question if someone is a veteran, but we also know that some people may not consider themselves to be a veteran. And so there's kind of like a list here. So sometimes we found that, women who've served in the military may not call themselves a veteran. Maybe people who haven't served in combat might not refer to themselves as a veteran, et cetera. But if you're asking a more broad question, did you serve in the military? You might get a different answer than if you asked if someone was a veteran. And this is going to be key in like that sort of like initial triage and even getting more information around whether that individual may be eligible for VA care and benefits like the Compact Act. And we'll hear from Community Care Department in a couple of minutes. So this is a slide that has some information around eligibility. And essentially, eligibility for Compact Act requires, someone to be eligible for VA treatment. It does not require them to be enrolled. They can choose their care either here at the VA or in the community as it pertains to this specific benefit. And there's just a lot of nuance to it, right? So there's some basic criteria as far as, service length of time or service in combat zone, et cetera. And there's also exceptions to that. So there are exceptions for if someone has a service connection related to medical or mental health, they may be eligible for VA care. And so what I wanted people on this call to know, without going into all the ins and outs of eligibility, is that if you were to contact our main number here at the Buffalo VA and ask for the Veterans Service Center, they would be able to give you a more individualized picture if you were calling about a specific individual and what their eligibility would look like here at the VA. Our next presenter will be Francine Spinella from Community Care. And so we'll allow her to present her slides and then Andrea Santiago as well. And then we'll certainly be open to take any questions at the end. Thank you.
Good morning, everybody. Let me just bring up the slides here and share my screen. Okay, does everybody see the screen?
Yes.
Yeah. Okay, perfect. Basically, my name is Francine. I'm the community care manager, and our department is responsible basically for processing the communications that we receive, particularly regarding the emergency care reporting situations. And those do entail the acute suicidal crises that are going on. We do process them internally on a daily basis. And we do have a team of 6 nurses that are responsible for reviewing and obviously taking that communication to other sources, such as internally with our mental health team, as well as any social workers that may be applicable. The veteran obviously can be seen at any facility based on the Compact Act. We actually are notified, and it is flagged within our national call center system when it is specific to a suicidal crisis. And also we have a team that does, like I mentioned, review that information. We are responsible for processing it. We communicate internally. However, we are not the ones who provide the authorization. I know in one of the slides, there was information pertaining to the emergency care reporting system that we should be utilizing, along with an email address when reporting. Basically, a family member can report that, a spouse or a friend or a family member, the veteran themselves, as well as the facility who has received the veteran. The processing is pretty quick. The notification process is pretty consistent, and we do manage through that pretty regularly on a daily basis and monitor that for any acute needs that are needed. At this point, the billing has been covered and will be covered by the VA, Andrea Santiago, who's going to follow me. And if there's any questions at the end, we can go over them specifically. Thank you.
Thank you. No problem. I appreciate you looking out for us. Yeah.
Andrea, I think you're next on deck.
Yep. Can somebody put the slides back up, please?
Oh, I can share them. Hold on.
Thank you. Perfect.
I can share them. I have
Yeah.
updated slides.
Thank you. Okay, my name is Andrea Santiago. I'm the Facility Revenue Manager for Western New York. My department bills veteran copays, and we also bill veteran insurance when they are seen at the VA or through community care. And for Compact Act billing for dates of service on or after January 17th, 2023, there will be no first-party veteran copay for any compact-related care. So veterans should not be receiving a bill from the VA for compact-related care. Third-party, which is insurance billing, is not affected by compact. So the VA is still going to bill veterans' health insurance for compact-related care. If a veteran does receive a bill from the VA for what they believe may be related to compact care, they can dispute their copay. There's a variety of ways. Number one is by contacting the patient advocate at the VA. This is the preferred method of notification. They can also call. There's a 1-800 number on every billing statement that they receive in the mail, or they can call the local VA, and when they speak with the operator, they can ask to speak with the billing department. They can also walk in at the local VA when they're there for an appointment. They can come in and let us know. We do have billing staff on site at the VA on the first floor. It's in room 136E. It's across from the pharmacy, and we have staff there on Tuesdays and Thursdays, and they can take any billing disputes or billing questions. Veterans can also mail a letter to the local VA to dispute it. They can submit an inquiry on My Healthy Vet. And as a very last resort, they can speak with their local congressperson or call the White House hotline. And any requests that we receive or copay disputes for compact will be reviewed, and we will answer them within 7 days of receiving them.
All right. Well, thank you so much for these presentations. Really, really helpful information. And so before we invite questions, I just wanted to introduce our interim Compact Act coordinators. One is Caroline Fagnan. She is our Veterans Justice Coordinator here at the VA. And we have Kevin Kiambo, who is also our co-coordinator for Compact Act. And he is a Navy veteran, and he's been a case manager in our HUD-VASH program for the past 9 years.
Thank you for introducing us, Dr. Nelson.
You're welcome. And so at this point, I would like to invite any questions that we may be able to answer for you. Feel free to come off of mute and ask your questions, or you can also ask questions in the chat box.
Hey, Nathan Doherty here from Erie County Veteran Services. I was late coming into the meeting, so I missed the first part. I was just wondering, is essentially the takeaway from this how the care received under compact is billed? Basically, no cost.
Yeah. Hey, Nathan, it's Katie. Yeah, thanks for joining us. We knew it was kind of quick content, but yes, the takeaway is that we want everyone to be aware of the benefit that if you have veterans coming, to you as a VSO, for example, saying, wow, like I have this, serious mental health issue and now I have this large bill from a community hospital, that you all would be aware of these benefits, and that they can be, there's sort of different catches as to how we can kind of catch, these encounters with clinical care. And if they come to the VA, certain, billing codes are put in for us to catch it. If they come to the community, we need to be informed. So we need Niagara Falls Memorial or ECMC or Olean General, any of those places to be letting us know that they are seeing veterans there for emergency suicide care, or the veterans themselves doing that and sending that information into us. And like Andrea had kind of went over, if someone gets a bill, kind of the first option would be to go through our patient advocate, and we have a clinical review team set up to really, request records from local hospitals to kind of see what the situation was, review them, and then make sure that we're kind of correcting any bill that they may have received erroneously.
Good to see.
Okay, thanks.
Hi, I'm Sean O'Neill from Congressman Nick Langworthy's office. I just had a question about the billing request. If somebody comes to us and has a billing request, where does that request go? Does that go to the congressional liaison and filter its way down, or should I go right to Buffalo VA with that, or Bath, depending on our district is pretty big. So would we go right to the VA on that, or should we just deal with our liaison and let it filter down?
From my standpoint, you could do either, whatever is easiest for you. And then also, Carolyn just put in the chat an email group that we're just starting to use for like coordination of Compact Act. So if you have some information that you wanted to send to us by email for us to review, if an individual was eligible for Compact, we could certainly do that as well. Kind of like a no wrong door. So whatever works best for you and for the veteran.
Right. Okay. Thanks.
Yeah. Thanks, Sean.
Reiterating what others have said, including Ms. Cork, but if locally, if if a veteran does present to the patient advocate with any billing complaints, it will notify all the appropriate, I guess, parties within the VA and in a review team, an internal review team, and it'll have billing on there. It'll have the Compact Act coordinators, suicide prevention, eligibility. A lot of people will be on there. So the patient advocate it should be useful going forward for anybody on here. So sending them that way. And then yes, for it also, if there's external providers on here, and say you're working with a veteran and their 90 days is coming up, or you have any questions about what to do, care coordination after that, you can also use this email that we have on here, because we would be on there and be able to answer questions.
Thank you for that. Looks like we have a question. Amy?
Hi, yes, I have a question. So I was just, well, hopefully this doesn't happen too often, but say if we have a veteran that's over at ECMC and CPEP and the hospital doesn't inform us, and then the veteran does not inform us, I guess, is there like a mechanism for catching that?
I mean, we would need to be informed at some point.
Yeah.
I'm going to defer a little bit to community care about the specifics of the timing. So like today, we're talking specifically about emergent suicide care, but there may be lots of reasons that a veteran may go to the hospital. And I think the legal requirement is that we be notified within 72 hours. There's more wiggle room with Compact, but so that's sort of the message we want to get out there, is if you know a veteran or are a veteran that's had to use emergent suicide care, that we want to, even a call, to the VA to let us know would help us sort of start the process on our end to make sure that that care gets reviewed and hopefully covered.
And this is Francine again for community care. Just to reiterate what Katie had mentioned, it is important that the communication does get to us specifically for the 72-hour notification as early as possible. There are sometimes some overarching scenarios that things would get approved, but it's specific to Compact Act. It would be like Katie mentioned, at least get the communication over to the facility so that we can start the communication within our internal processes. And then there are ways sometimes that we can go back and bring in that information to tie it in to get that covered. But again, it's a case by case basis and it's not always consistent. So it's always best to just notify, even if it's duplicative or, multiple times. We can adjust those duplications to one, but as long as we would rather be over notified than not notified.
Right, yeah, I guess, just wondering what happens if the hospital or the veteran doesn't notify, in those cases.
As mentioned, it's a case by case basis, but again, when the notification does come in, we do evaluate that in particular. As we described earlier, the process does typically come from the call center for the most of the notifications, either by phone or there is specifically an email that can be used. But it's always best to over notify. And again, the notifications do process for authorizations by the call center. Community care does not process those. We can look at them and see what the status is, but we do not process those specifically for anybody who self-presents from the emergency room, regardless if it's Compact Act or other needs.
And then Amy, as a
Okay.
VA clinician, if a veteran tells you, oh, this past week I was at ECMC and, it was for a suicide related reason, you can put in that notification note in the record. And so that will notify community care. And if like if it's a crisis,
Yeah,
right? If the veteran doesn't notify, and ECMC is really good about it actually, but
right.
if they
I
don't
guess,
notify and the
yeah, I
vet
guess
gets a bill,
maybe
they could bring
my
that in.
question wasn't specific enough. So like, obviously as providers, and I cover the ED and I used to work in CPAP, so like it's very much on my radar. But I'm just wondering, like, say if the hospital, the nurse that's evaluating or the doctor doesn't, reach out to us. So is there like, does the billing department kind of catch that and say like, oh, we had, so and so here who's a veteran? I mean, is there another mechanism is what I'm asking. So I know it's always good to over-report and, we need to report in 72 hours, but I'm just wondering, I guess I just had a curious question there.
So Amy, just to clarify again, so there are times that even when the veteran presents to a facility, it really goes down to the last hour and the last minute. It could be, 71 hours and 59 minutes. And I've seen things come as close as that. However, it does not mean that that information wouldn't be reviewed to validate, whether or not the reimbursement from the VA would take place or not. It's just, again, as soon as it's better to put a documentation in there. I mean, I've reviewed charts where there is documentation and you do have to look through it. It's like, like reading through many documents, but at least if there's any type of documentation or any blurb or anything that facilitates that the veteran has been in a community facility, it is beneficial to processing it. Whether it gets covered or not would be determining on the status. And it's specifically, we're talking here Compact Act. So the majority of the time, it is going to be important that that documentation get to us as soon as possible.
Okay, thank you.
You're welcome. Thank you.
That's a great question. Anything else for presenters or really any of us? Do you have any questions?
Is this time limited?
The legislation.
Yeah, is this just moving forward? This is going to always be the case?
I mean, yes, I would assume so. So it's moving forward. It's not like a benefit just for this year or anything like that. Sometimes there's new legislation that, reclarifies or, offers different benefits, but this is, law at this point.
Okay, great. Thank you.
Yeah.
Hey, I think the question was more about like retro payments for does it like so PACT Act went back like a year, right?
Yeah.
So does this compact?
Yeah, that's a good question. So, and we've asked that question too, like my suicide prevention team, but this one was effective January 17th. So as far as if you have a veteran that you're meeting with, who had that emergent suicide episode, and we wanted to run it through the patient advocate, if they received a bill, it would go back to January 17th, 2023. And we want to hear from these veterans. So we'd love to connect them with clinical care. We'd love to, provide some case management, as much as they would like to. But if you have a veteran with a bill, we do have a process to review those. So please, contact us, contact the patient advocate, and we will take a look at it.
And just so you all know, we do have a team that reviews a lot of these cases. So that team encompasses mental health, eligibility, primary care, medicine. So several areas, community care, revenue, all of those areas, we get together and we make sure that these cases are well reviewed. So just as a point of information.
Barbara, I actually you bring up a point, and it's kind of my question is kind of germane to the Compact Act, maybe not necessarily with the billing, but more the process. So let's say I have a Navy reservist or Marine Corps reservist or National Guardsman. They're not enrolled in Tri-Care Reserve. They've never done anything with the VA. You get them to actually call the hotline if they're having suicidal thoughts. And at what point does that call connect to the VA? And if somebody can walk me through the process on the VA's end.
Yeah, Nathan, for like the Veterans Crisis Line.
Yeah. I mean,
Yeah.
I'm just kind of thinking about the whole process. So like when
Yeah.
I tell them, hey, this is what happens when you call the number, like I've done it. So like I know what happened with me, and they send like, this
Yeah.
reminder thing once every 3 months. And it's like, okay, cool. Maybe it's not actually from a real person, but it feels like it is. So it checks the
Yeah.
box and it's useful and everything. But I'm just like, what's the process? So I'm somebody in that scenario, no TRICARE, no paperwork at the VA, maybe a 214 that's uploading BVMS from like more likely 2 years ago. But you know what I'm saying? Like no real paper
Yeah.
trail
Yep.
at all.
I
What's
know
the process
exactly what you're
there?
saying. Yeah. So like when we talk about eligibility, sort of all of that goes out the window when we talk about the Veterans Crisis Line. So the Veteran and Military Crisis Line talks with active duty, talks with people who meet like the federal definition of veteran, talks to anyone who's served or anyone calling about someone who's served, right? So regardless of eligibility status or enrollment status, any of that, if veterans call the crisis line, the Veterans Crisis Line, it goes to a essentially call center, right? You can call, text, or chat with the Veterans Crisis Line, and they sort of talk with you in that immediate moment. So whether it's 3 in the morning or 10 in the morning or 3 in the afternoon, you're getting a live person to speak with in the moment. And so sometimes I say 100 vets from Western New York may have called the crisis line last night, but our local suicide prevention team receives consults on anywhere from like 1 to 15 of those vets. And so typically the people that we receive like a electronic consult on, the eligibility doesn't matter. We talk to people all the time who aren't eligible for VA services. But we get like an electronic consult that says who called and kind of what was the reason and gives us a phone number to call them back. And typically the people we receive consults on are anyone that had an emergency. So like they had, a very acute suicide emergency. Anyone who says, hey, I'm going to go to the hospital, like I'm going to bring myself there. I'm going to have like a friend or family member bring me. And then anyone who wants a consult. And so it is all the way from, hey, my dad's a veteran and he's moving from Florida next month, and we really want to coordinate his care because he has some specific medical care, to a mental health need. And then they get a call from someone on my team within 1 business day. We try to follow up, so hopefully everyone has like their voicemail set up and like gets our voicemails and calls us back if we don't reach them. But we can connect people with care here at the VA or in the community. Sometimes we even know of mental health agencies who offer free care to veterans with specific needs, like specifically specifically for PTSD. Some people are calling about housing needs. So we kind of work as like a central triage for those veterans and kind of connecting them with the care that they need, whether that's VA or the community.
Okay, thanks. Appreciate it.
Yeah, no problem. Other questions or thoughts? Well, we have this captive audience.
Hi, it's Kayla. I just wanted to say thank you for the information. It's super duper helpful. It's great to have kind of eligibility on a slide that you can just kind of reference. So thank you for doing the legwork to Katie and Kevin and Carolyn, because it's really big for us. So it's very much appreciated.
You're welcome.
Yeah, and for those calling from, community and not at VA, we wanted you to have faces and names of people to contact if an issue does come up, so that you could call or email us, so we can kind of figure out whatever it is that comes up, and make sure we kind of, bring veterans care in the way that they need it to go, and also, rectify any bills if they are billed and shouldn't have been.
Any other questions before we close?
There's a question from Natalie in the chat. Hi, Natalie. Thanks for asking that question. The question is it just active duty? And what about ACTUDRA, which is an acronym I'm not familiar with? But regarding the active duty, it is active duty and some reservists, depending on the nature of their service. But the important thing is just for all providers to ask the patient if they're a veteran, if they served in the military, and then our eligibility department will figure out the rest. But if you're interested in the eligibility, you could email the group that was posted in the chat by Carolyn. Email that group and we can share that eligibility information with you. But the short answer is active duty and some reservists.
Thank you for that. Any other questions? So please do feel free to reach out if you have other questions that occur to you later. Really happy to get any information to you that is needed. If we don't know, we will find a person or a place for you to get that information from. So we absolutely want to do the legwork to ensure that our veterans are cared for, excuse me, whether it's within the VA or outside in the community. All right. Well, if nothing else, thank you all so much for joining us. It's been a pleasure to provide the information that you may need to take good care of our veterans. If nothing else, have a wonderful remainder of your day.
You as well. Have a great day.
Bye now.